A systems approach to global health. The objectives this week are to evaluate the epidemiology of selected health threats and diseases, discuss the differences between the impact of diseases and health threats on developed and developing countries, analyze the impact of politics, religion, and socioeconomic factors on the prevention and treatment of diseases and health threats, relate how issues involve global research to support evidence-based nursing practice. Key terms and concepts. Prevalence, the total number of cases, both previously existing and newly diagnosed, present within a population at any given time in terms of disease. Incidence, or morbidity, and refers to the number of new cases of a given disease reported each year. Mortality rate, reflects the actual deaths due to a specific identifiable cause. Fertility rate, a measure of fertility in a specified population over a specified period of time, particularly the general fertility R, which is the number of live births in a geographic area in a year per 1,000 women of childbearing age. Globalization, the increasing interdependency of countries and the openness of borders to ideas, people, commerce, and finances. And finally, burden, which refers to the size of a health problem in a specified area, as measured by several statistics, such as incidence, mortality, rates, and prevalence, as well as other indicators such as cost, morbidity, and risk factors. A systems approach to healthcare focuses on developing resources and skills across an entire organization, not just training individual providers. The 4 basic principles include human rights-based approach, survivor-centered approach, quality care approach, medical ethics for care approach. The human rights-based approach, this is based on information from the United Nations entity for gender equality and the empowerment of women. This is just one example of how we can use a human rights-based approach to healthcare. One example is to analyze root causes of problems and address discriminatory practices that contribute to violence against women and to the ability of survivors to access assistance. You can read more about this example at the following website listed below. Survivor-centered approach. This is another example based on the United Nations entity for gender equality and the empowerment of women. The example is that all those who are engaged in violence against women, programming prioritize the rights, needs, and wishes of the survivor. There are many examples of a survivor-centered approach, and for more information on this example, please read the website below. Quality of care approach. Again, this is an example by the United Nations entity for gender equality and the empowerment of women. Service quality can be defined in terms of the different dimensions outlined below, each of which is dependent on the other in order to realize overall quality of care. The priority is always to promote the health and well-being of survivors. As healthcare professionals, we always center our care on the issue of quality for all patients. Examples include equity, effectiveness, efficiency, access, appropriateness, choice, and acceptability. To read more on each of these items, please visit the following website. The medical ethics of care approach, again, this is based on the United Nations entity for gender equality and the empowerment of women. It includes a fundamental duty of all health workers that they use their skills in an ethical manner and observe the laws of the community. Below are autonomy, benefits, non-maleficence, and justice, all principles of the ANA Code of Ethics. To read more about each of these principles, please visit the following website listed below. Another way to approach looking at healthcare with the use of systems is how we address patient safety. The following is taken from the Agency for Healthcare Research and Quality, or AHRQ. The systems approach provides a framework for analysis of errors and efforts to improve safety. There are many techniques to analyze errors in patient safety. Examples of these techniques are a root cause analysis, a retrospective chart review, or a failure mode effect analysis. This slide will be looking at health systems approach in the healthcare of the United States. It is supported by organizations such as USAID, the Quality Assurance Project, and Healthy Systems 2020. The main principles include governance, health financing, health service delivery, human resources, pharmaceutical management, and health information systems. The idea is that all of these principles work together and collectively to provide a well-encompassed and all well-rounded health systems approach to healthcare in the United States. Below are key principles needed in order to strengthen the healthcare from a systems thinking perspective. They include being self-organized, that healthcare systems are constantly changing, that the variables are tightly linked, that there is governed by feedback of peers and other providers. It's non-linear, meaning that it will grow. It is history dependent, meaning we look back on history on ideas that worked and ideas that did not work. It's counterintuitive and resistant to change. This slide will discuss 10 steps needed in order to provide systems thinking in healthcare. Number 1, convene stakeholders from across the health system, plus selected intervention designers and implementers, users of the health system, and representatives of the research community. Number 2, collectively brainstorm on possible system-wide effects of the proposed intervention. Number 3, conceptualize effects to map how the intervention will affect health and the health system as a whole. Number 4, adapt and redesign to optimize synergies and minimize any negative effects. Number 5, determine indicators that are important to track in the redesigned intervention. Number 6, choose methods to best track the indicators. Number 7, select evaluation design that best manages the methods and fits the nature of the intervention. Number 8, develop a plan and timeline to propose the intervention. Number 9, set a budget for considering implications for the intervention. And number 10, source funding to support the evaluation before the intervention begins. Overview of systems thinking. Systems thinking can strengthen health systems to deliver interventions to those in need and produce health with equity. It requires a community of practice, thriving networks, and practical initiatives. To read more on systems thinking, please visit the website below. Another way to view systems in terms of healthcare is how that they can drive value. The following information is supported by the Institute of Medicine, and this states that there are 4 stages of a system approach to drive value in healthcare. Number 1 is identification, in which you need to identify the multiple elements involved in caring for patients and promoting the health of individuals and populations. Number 2, description. So describe how those elements operate independently and interdependently. Number 3 is alteration. Change the design of organizations, processes, or policies to enhance the results of the interplay and engage in a continuous improvement process that promotes learning at all levels. And number 4, implementation. Operationalize the integration of the new dynamics to facilitate the ways people process, facilities, equipment, and organizations all work together to achieve better care at a lower cost.